So there have been a number of studies, many of them presented here, that have examined both indoor and outdoor air pollutants and the impact that they have on asthma and airway allergic disease. A few things. First of all, what's very clear is that both ozone and particulate matter continue to be shown to be able to enhance and worsen asthma. It's been clear that ozone and particulate matter have been able to increase response to things that people are already allergic to. So for instance, if you're exposed to pollutants and then you end up being exposed to something you're allergic to, you're going to be more responsive to that. A few things that have emerged that are important. Number one, indoor allergens and indoor air pollutants are important. Particulate matter, which is both outdoor and indoor, can be a big deal. So there are beginning to be studies, some of them being done at Johns Hopkins University, some being looked at in Cincinnati, that are beginning to look at what environmental things you might do, whether it's specialized air cleaners or other things in the home that might be able to minimize the impact of these pollutants on asthma. More recently, the other things that have emerged have been the effect of ozone on airway disease. What people folks in my lab and others have shown that levels of ozone even lower than those currently regulated by the EPA. So the current low-level standard for ozone is 0.075 part per million ozone. And our group has shown experimentally with human volunteers that levels as low as 0.06 part per million ozone can cause physiologic changes that, if they occurred in people with disease, would cause disease. What's really emerging is that there are problems with air pollutants worsening asthma and allergic disease. Perhaps more intriguingly is the possibility that pollutants may be contributing to people becoming allergic as well. There have been recent studies done by Academy investigators demonstrating that if you look at chemical reactions caused by air pollutants, mostly in particulate matter, those chemicals can actually cause epigenetic changes in people that are associated with increased likelihood of being allergic. One of the best demonstrations of this was done by Carrie Nadeau in California, looking at individuals who lived in Fresno and people who lived in Stanford. And what they have found is that there's a relationship between decreased FOXP3 bearing peripheral blood cells, which are the T regulatory cells, and severity of asthma that's worse in Fresno. And furthermore, what she's found is that the relationship between DNA methylation, which is the epigenetic change that was associated with this, that's more robust in the children from Fresno as well. What we're beginning to find is, just as allergens are an environmental stressor that causes the immune system to respond in a pro-allergic way, there's evidence that, at least in some individuals, air pollutants can also cause those things. So what writ large that information means to me is threefold, and were areas of investigation that are very germane to people who study allergy and clinical immunology. Number one, we need to use this information to tighten and inform policymakers about what levels of pollutants really are acceptable and not. Number two, as we better understand the mechanisms, we can understand which populations and which groups of people are at higher risk and maybe focus interventions towards them. And three, we actually need to find interventions that could be used. Those might be medicinal, a higher focus on inhaled steroid or other therapies for that. It may be environmental things they can do within their homes, or it may even be social policy things like zoning laws. So perhaps we would inform families that living close to certain areas with certain types of pollution may be a problem.